Welcome back to another episode of Christian Natural Health. Today, I'm excited to have Dr. Alan Bauman with us. Dr. Bauman is an accomplished hair restoration physician known for his expertise in treating hair loss and his pioneering work in the field. His state-of-the-art hair hospital in downtown Boca Raton, Florida, covers 12,000 square feet and is recognized worldwide for its advanced hair restoration technologies. His dedication to the field of hair restoration has earned him many accolades throughout his career. He is one of approximately 200 physicians worldwide to have achieved certification from the American Board of Hair Restoration Surgery. He has pioneered numerous technologies in the field of hair restoration. Dr. Bauman's expertise has made him a highly sought-after speaker and guest expert. He's been featured in hundreds of news stories in the media. Dr. Bauman has also been recognized for his contributions to the field of healthcare, receiving the 2022 Lifetime Achievement Award in Hair Restoration and being named one of the 10 CEOs transforming healthcare in America by Forbes. Welcome, Dr. Bauman. This is fantastic.
Thanks so much for having me, Lauren. It's great to be here with you.
For sure. So first, let's talk a little bit about root causes for men and women for hair loss. Let's start with men first of all. What's usually the underlying causes, and where do you kind of start in terms of digging up all of that?
Sure. Well, first of all, about 50% of men are going to experience hair loss by the time they age 50. So it's a big concern out there. There are tens of millions of men who are struggling with hair loss. The interesting thing is that it's primarily genetic. So in men, we know that it's a genetic sensitivity to their male hormones, specifically dihydrotestosterone, DHT, that triggers the miniaturization, the weakening of the hair follicles over time, and eventually pushes them beyond repair so that they do not provide any coverage by creating the hair fiber.
Got it.
So over time, anytime after puberty, actually, depending on their genetic propensity for male pattern baldness, they could see a receding hairline or thinning in the crown. And it's progressive, it's chronic, it gets worse with time without treatment. And it can progress to total baldness across the top of the scalp, but usually spares the hair around the sides and the back. So we call that androgenetic alopecia. And that's the primary trigger or primary cause for male hair loss, although there's others. There's autoimmune conditions, spotty hair loss, scarring, and things like that.
So, and for guys, like, let's say a guy comes to you who doesn't have a family history, but he starts losing hair younger. Is there anywhere that you would start in terms of like digging for root cause in that situation? Or what would your first thought be in that case?
Well, it obviously depends upon what kind of hair loss they're experiencing. So I do have young male patients who are literally in high school who have a bald spot in the back of their crown. We certainly look for root cause. In fact, I have an entire functional medicine department inside my practice. So we're looking at everything from sleep-wake cycle disorders to nutritional problems to metabolic diseases. And as I mentioned before, there could be autoimmune diseases that could be triggering hair loss and making the hair follicles just, a difficult job to perform the hair growth function. So we're going to be looking at all that. But if there's that pattern that I mentioned, either receding hairline or balding in the crown, that tells us that there's at least a genetic underlying tendency, and that our primary treatment option might be something to block the androgens in the scalp, whether that's a nutritional or nutraceutical or a prescription product. We might go down that road. But certainly we want to look at lifestyle factors as well, because some of these young men might be doing things that are boosting their testosterone levels, maybe not even naturally, obviously, but even just resistance training and sports training and things like that can dysregulate hair follicle function. We have a lot of athletes in the practice who seem to have excessive and aggressive male pattern baldness.
Interesting. Okay. So
things that accelerate it could also be illness. So if they've had COVID recently or multiple bouts of COVID, that certainly dysregulates the circulation and the hair follicles. It creates a cytokine storm if it's severe. If they had fever, absolutely, we're going to see some shedding. And anything that makes the spike protein, and everybody's favorite jab included, can dysregulate the hair follicle. So I've treated over 1,000 COVID hair loss patients.
And so my understanding is with COVID hair loss, it usually has to do with the telogen effluvia. Is that also your understanding of it, or is there more to it than that?
Well, telogen effluvium is just the name of a fancy word, really, for hair shedding. When the follicle shuts down and in between the new growth phase, the
Right.
hair fiber is exuded. It's extracted from the hair follicle and basically falls out. So effluvium is like a wave. So if you have a wave of shedding that's higher than normal, guess what? You get diagnosed with telogen effluvium, but that does not tell you the root cause.
Mhm.
So, if you've had that high fever, of course, that can shut down hair follicles. If you've been exposed to, like, say, general anesthesia, that could also be a trigger. If you've had a sudden change in hormone levels, that can also trigger an effluvium. But what's interesting about the effluvium with COVID is that it seems to dramatically accelerate, in many cases, at least cases that I've seen, dramatically accelerate male and female pattern hair loss.
Fascinating. Okay. So once you've diagnosed that root cause to say, here was your trigger, like give me a couple of ideas of what you might do. Like, let's say somebody has an inflammatory issue such as that, like a cytokine storm, or they have
Mm.
an autoimmune condition. Where do you begin in terms of helping to calm things down and get their body back to a reset button to where it was before?
Yeah, sure. So the interesting thing is that we do have some therapies and treatments that could immediately address an effluvium, let's say. So if they did have a COVID infection or are dealing with long COVID and shedding, or even postpartum, a lot of women will, I'm sure we'll get it deeper into female hair loss.
Right.
We can actually do a treatment immediately to address shedding, and that's kind of different than therapies that we've had years ago. We have a treatment called TED, transepidermal delivery of growth factors and peptides, using a technique called sonophoresis, which is ultrasound, that
Uh-huh.
breaks the stratum corneum, or disrupts it, I should say, and
Mhm.
allows us to push those very powerful growth factors and peptides right through the skin in office treatment with no needles, no pain, very relaxing, just vibration essentially.
Mhm.
And one treatment per month, the first thing that they notice is the shedding starts to slow down and eventually stop.
Okay.
But obviously, from a functional medicine approach, my team will look at overall body inflammation, look at the diet, look at things that are in the environment. I want to deal, if we're dealing with a stressful situation, is there stress management skills that we could use? Sleep, the Swiss Army knife of wellness, is a tool in our toolbox to obviously help that. But there are, even nutritionals that can help with inflammation, curcumin, turmeric, getting on a good probiotic, and we have those under the Bauman brand specifically for hair, and
Mhm.
providing good fuel, if you will, and nutrients for good hair growth is obviously critically important in those early stages before we move on to something more aggressive.
So, yeah. So, and for a guy where it's just in the family, it happens to everybody at about that same age, if he's had hair loss for a really long period of time, like he's got a full-on bald spot, he's not losing it, it's gone. Is there anything that can be done at that point? Where do you start in that situation?
Well, well, look, hopefully we can do some things to protect the hair that he has. But if he's already got a growing bald spot, and they do get bigger with time, like on the crown, they start small and then they get wider.
Yeah.
We will put him on some medical therapy regimen. So if we're dealing with nutrition and nutraceuticals, it could be saw palmetto and some of the other things that I've mentioned. We could put him on a good hair care product, making sure that the scalp is not inflamed. And then we get into other therapies. If it's medications like minoxidil or finasteride, those can be applied topically or orally. Minoxidil is a potent hair growth stimulator for men and women, can be used topically, as we see from the old Rogaine, but also now is available orally, which is nice, with a very, very low, very, very low safety, very high safety protocol, very low incidence of side effects with a microdosing. And for men, finasteride is another medication, obviously, that we can use very effectively to lower the DHT production in the body, or specifically right at the level of the scalp. We can also use red light therapy. Low level laser light has been a part of my practice for over 20 years, and that's a very common treatment to stimulate hair follicles to grow thicker and better and stronger over time.
Yeah.
And other treatments like regenerative medicine therapy, platelet rich plasma, TED, as I mentioned previously, exosome therapy, PDO grow. These are all things that we do in the office to try to stimulate the existing hair. But you asked, what if there's a bald spot?
Yep.
And so the answer is, if there's a bald spot, we have to talk about transplants.
Got it. Okay. So at that point, you're at that level, but if you're in the process of losing, then there's things you can do to mitigate and maybe even regrow because the follicle isn't totally dead. Is that about right?
Absolutely,
Yeah.
because the hair follicle miniaturization process typically takes years and years.
Right.
So if we can catch the hair follicle before it's totally beyond repair, and there are some ways to figure that out by looking under the microscope. So using very, very powerful magnification, even with the help of AI powered microscopes today, we can see exactly what the hairs are being produced in terms of their thickness, which is a really good indicator, their length, another good indicator, their pigmentation, as well as the density in each of the different zones. So that's something that we do in the office called hair metrics, very powerful AI microscope using the artificial intelligence to get all of that data. So
Yeah.
that helps us with the diagnosis because obviously areas that are looking good just need prevention. Areas that are starting to weaken, you may not even know that
Right.
it's weakening out in those areas. Those need the rejuvenating therapies. And
Right.
areas which are severely depleted, well, then we're going to have to move some hair follicles around from other places to
Got it.
fill in the gaps.
Got it. Got it. Okay. So let's go back to the LED that you're talking about, or the red light therapy. Tell us a little bit more about how that is. Like, what is this device? What does it look like? And how do people utilize it? How does it help with hair follicles?
Yeah. So the first thing I want to differentiate is that there's a lot of red light therapy out there in the market for overall wellness. Some people use LED blankets and things like that. But what we're really talking about for hair, we need more than just what an LED provides. We need laser light.
Okay.
So the lasers that we use, they are laser emitting diodes. So, but they are not incandescent lights.
Okay.
So, like if you got a Juve device for your house in your closet or something, that's not going to grow your hair back very substantially. You'll need a laser cap. And so laser caps were invented by Dr. Michael Rabin. Those are typically head-worn devices. They kind of have a shape of a dome, maybe
Yeah.
fit underneath a baseball cap traditionally. But the newer ones that we've worked on are a lot more portable, a lot more powerful, much shorter treatment times, and are all FDA cleared for hair regrowth. So these are units that are highly flexible. Imagine like a device that could pack completely flat, but then you curl the tips over and then you can snap it together and put it over your scalp. So it's not like a baseball helmet. It's
Okay.
not like a bicycle helmet or baseball hat, I should say, but something more flexible and portable. And that's called the turbo laser cap.
Mhm.
And so what does that do? It provides this red light that's non-burning, non-cutting,
Mhm.
completely side effect free.
Mhm.
And red light affects the mitochondria that are located within the cells of the hair follicle.
Mhm.
And so just like red light's used for rejuvenation of the skin, to decrease inflammation in an injured joint, to speed up healing after a procedure or treatment or surgery, we can use red light to stimulate those highly metabolic cell populations, which are located in the hair follicle, making the beautiful, healthy hair fibers, hopefully. And so providing that extra bit of energy through ATP production right at the level of the mitochondria is what red light therapy actually does. And you get a thicker, stronger, healthier hair
Mhm. That's awesome.
with only one caveat. As we said before, if the follicle's dead and gone or beyond repair, then you're out of luck on that.
Gotcha. Gotcha. Okay. And so for women, what are some of the most common causes of female pattern hair loss, or not even necessarily female pattern per se, but just female hair loss in general, if it's this more
Yeah.
systemic cause?
So, yeah, so I would just say, starting off, that the female hair follicle is much more sensitive than male hair follicles to a lot of different dysregulations. So, problems with nutrition, issues with inflammation, medications that you might be taking, hormone changes. Obviously, things are a lot more complicated when we talk about women and hormone optimization and lifestyle factors very oftentimes. So, there may be more influences. Also, women do things a lot more aggressively to their hair. They might wear hair extensions more often than men. They might use chemicals on their scalp to straighten the hair, certainly to color it more often than men. They may use high heat on the hair fibers. So sometimes we get hair breakage, and the hair breakage has nothing to do with the hair follicle. It's just how you're treating that dead fiber. It's just like, mistreating your fingernail. Obviously, it's, not going to be good. So
Sure.
if you mistreat the cuticle of your hair fiber, it could lose its aesthetic value and that will not self repair.
Mhm.
So it's really important to grow good hair from the beginning. We
Mhm.
talked about female pattern hair loss. That isn't typically some androgen sensitivity, but it looks different in women than it does in men. So androgenic alopecia in women typically doesn't create a big bald spot in the crown. It will actually just deplete diffusely through the frontal zone. And
Mhm.
eventually you might see a little bit of a recession in the temples,
Mhm.
mainly because the density there starts out pretty low. And so it's a more sensitive area to loss of coverage.
Right.
So a woman might notice, for example, that her ponytail is shrinking, that she's got a wider part line than she used to,
Mhm.
that the hair caliber is changing so that she has to change her hairstyle. Or as I said, receding hairline in the temples, perhaps, and she's got to change her hairstyle to kind of cover it over. to provide an aesthetic frame of the face.
Yeah.
A lot of women are also born with a high hairline to begin with, and just simply through no genetic other genetic tendency or even sensitivity or other illness or dysregulation, they just have a high hairline and they
Mhm.
don't like the way that looks.
Yeah.
And so there's a lot of reasons why patients may come to visit us here at Bauman Medical,
Mhm.
men and women,
Yeah.
depending on what's going on. Women also can lose their eyebrows and eyelashes,
Mhm.
and not to mention things that can go wrong after plastic surgery,
Mhm.
leaving you with scars or changes in the hairline and other things like that that need to be covered with hair.
Mhm.
So I
Okay.
know that was a lot,
Mhm.
but autoimmune conditions are very common. The hormone, obviously, dysregulation and imbalances are something that we would look at. How's your thyroid hormone? What's going on with your female hormone levels? And take a look at all of that. What's your nutritional intake? Are you on a special diet? If you're following a restrictive diet, like even just vegetarian or specifically vegan, it's very difficult to maintain good protein intake. And if you're a little bit iron deficient or prone to that, sometimes it's even worse. So you
Yeah.
start stacking all these things together.
Mhm.
Um, the most recent trigger, I think, in terms of like man-made hair loss, is Ozempic or the semaglutide weight loss programs, which seem to be kind of a quick fix for many people. I don't recommend it long term, but it can really trigger a lot of hair loss.
Yeah. Yeah. Definitely makes sense. So, and for women, is there a difference in terms of the way that you would approach it? It sounds like it's really individualized for each individual person as far as what you do from a functional medicine standpoint. But how
Mm,
would you go about deciding who gets what of the additional actual treatments that you're talking about? So you talked about quite a variety.
sure.
How do you narrow it down?
Right. So, I mean, all starts with that basic algorithm that I kind of led you through a little bit, like the background, the medical history, hair loss in the family. We might do genetic testing. And then what are the signs and symptoms that we're dealing with? And then we look at those lifestyle and holistic factors. What are the hairstyling habits? And then we talk about what are we trying to accomplish here? Maybe we look at the scalp and there's like all kinds of inflammation. There's dandruff or there's irritation. It's very oily or very dry on the other end. And so a lot of the scalp health stuff that we find has to be mitigated first because that's the soil for the plants, right? That's the garden, right? So we have to get the soil right before we work on the plants. And so sometimes patients will go through a process with my trichologist in-house to rectify that.
Mhm.
And then we can start a more robust hair regrowth regimen.
Mhm.
If they're local and the hair loss is mild, then they may just start those, the functional medicine program, get their nutrition on point. They might start with nutritionals and nutraceuticals, some of which we curate, some of them which we produce. Get that protein intake up, and let's track it over time. Or they may elect for something like the TED procedures that we just talked about, which are very, they're non-invasive at all. In fact, they're very relaxing on the scalp.
Yeah.
Or we might need to do something more aggressive, like a PRP injection, to get things going in the right direction. But again, if the follicles are dead and gone, or we have a scar, or we have an area where it's really, a receding, deep receding hairline, then we might need to do some degree of transplantation, or at least plan for it sometime in the future.
So for the TED procedure versus the PRP, sounds like PRP is more aggressive. So do you do microneedling for that or do you do injections for that? Or both?
So the TED has none of that, obviously, which is really nice. It's just the instrument itself on the skin that vibrates and disrupts the stratum corneum layer, which is the moisture barrier, right, and allows us to push those growth factors and peptides that literally come out of a bottle into the scalp. So it's a very, very consistent process, and that's once a month for 4 months,
Okay.
and you'll
Mhm.
see some really nice improvements in hair regrowth,
Mhm.
thickening of the follicle, the lengthening of the hair, even a darkening, a repigmentation in many cases are what we're seeing, which is very, very nice.
Yeah.
Um, but PRP, we've been doing for many, many years, 18 years of PRP treatments.
Mhm.
We'll take a blood draw of about 60 cc's. We'll use local anesthetic while that's going on. And we're doing a dual spin to harvest out about 10 to 12 billion platelets. And
Mhm.
it's injected into the scalp in a painless way. So it's local anesthetic, a complete scalp block,
Mhm.
not a painful process, but it is injections.
Mhm. Okay.
Um, my PRP process finishes with a microneedling pass across the skin. We
Okay.
do inject a calcium chloride releasing agent, which basically triggers the platelets to do their business. And then I love to microneedle the skin just a little bit, just to trigger that repair process to let the platelets know, hey, we've got to do our business right here. right at the level of the scalp. And we also use laser light therapy before and after our PRP treatments. And very often we might even use perinatal biologics or exosome therapy in conjunction with the PRP, or even some synthetic scaffolds like PDO threads to put in under the skin at the same time.
Okay, I'm not familiar with that. What are those PDO threads?
Oh, PDO is amazing technology. Polydioxanone is a synthetic, slow absorbing, used to be a suture material back in the 1980s. Anybody who's gone through surgery and had like a purple stitch placed into their skin or their belly knows that it lasts for about 6 months. So it's a very, very slow absorbing suture material. It's used in cosmetic procedures today to improve wrinkles and cellulite, sometimes to tether the skin in different ways with varying results. Obviously, ask visit an expert for that kind of thing.
Sure, yeah.
But we can put those synthetic tiny little threads in under the skin just below the hair follicles, and as they absorb over the course of 6 to 12 months, you get a boost of hair growth.
Oh,
And so
so
that really, it's a really exciting technology to include with PRP.
interesting. So it's kind of like you're stimulating blood flow based on the fact that you've got something foreign there that needs to be absorbed. Is that kind of the concept, or?
Well, we don't exactly know the full mechanism of action, but we do know from biopsies in the laboratory and also even on mice that this material, first of all, is very, very inert. It doesn't create a big reaction at the level of the skin. And that's one of the reasons why it was FDA approved back in the 1980s as
Okay.
a slow absorbing suture material. And it's used as mesh for, for hernia operations. It's used in many, many different places, probably millions and millions of surgeries over the course of decades, obviously, and millions of patients across the world. So it's a very, very safe material. It does not create a reaction. In fact, looking for skin reactions from polydioxanone are very, very rare. You can't even find them in the clinical literature. It's very difficult. So it's a very safe material, essentially, to use in the skin. And so it dissolves over time. I mean, maybe there's something with the enzymatic degradation that the body is doing to kind of take care of that little tiny thread that releases growth factors and triggers the body's natural healing process, which therefore enhances hair growth in many cases. So doing that with the PRP and even our PRP alone, we're going to have about 10 to 14 months of boost from a single treatment instead of a series of 3 or 4 or 5 or every month coming in for a therapy.
Got it, got it. And so all of the things that you've just listed, it sounds like you do a lot of like stacking of different types of therapeutics. If somebody has like microfollicles, for example, like they're smaller than they should be, will this cause them to become more robust or more dense hair growth, or what exact, or do you just do you expect it at the microscopic level to change?
Sure. So, when we look at the scalp under the microscope, as I mentioned before, there's
Mhm.
a whole gradation, a whole spectrum of how good the hair could be, right? The best hair is like thick like an oak tree and tall as a sequoia, right? But as you go weaker and wispier, then that tree becomes thinner and shorter over time and actually less pigmented. You can see right through it. So we go from in many cases, a very, very, very thick hair that would normally live around the sides and the back of the scalp to a super thin, wispy hair that we would see perhaps in the temples or in the thinning zone near the frontal area. And so if the follicle is beyond repair, we're going to let you know that. But if it's just miniaturized, then there's a great opportunity to trigger regrowth. And a lot of our choices may have to do with your lifestyle.
Mhm.
A busy college student may opt for a PRP treatment because it's a set it and forget it therapy. For the year, he's good. He doesn't have to worry about topicals or using a laser in his dorm room or something like that.
Okay.
A busy CEO, same thing. For our women, who are busy at work and doing their things, PRP is a great treatment, especially when there's a lot of weak hair.
Sure. That makes
But
sense.
then again, we're very realistic. We know after a certain period of time, we're not going to see much more results from the PRP. So what's happening? Have we stabilized the situation? We've improved it quite a bit, but we still need more hair. Well, then it's time for the follicular unit extraction transplant process, and that's changed a lot over the years.
Okay. So, and how has that changed? How has hair transplant kind of evolved?
Wow. So in the 25 years that I've been in the field of hair transplantation, it's changed light years. So years ago, we were stuck with only what we call strip harvesting. So we would have to take a strip of skin out of the back of the scalp and suture or staple it closed, and then use that tissue, that donor tissue, and dissect it under the microscope into individual grafts, which
Wow.
contain small groups of hairs. But today, we now have instruments that are smaller than the tip of a ballpoint pen, which allow us to extract the follicles directly from the donor zone. That's where the hairs are good, and redistribute them into the thinning or the balding areas in a very comfortable process, in a very repeatable process, and in a completely natural way that has a super fast and comfortable recovery. So we're not dealing with a linear scar or stitches or staples or some, staying out of the gym for a month. Forget about all that. You could be back in the gym in 3 days after this procedure, and completely healed in 6 days.
Wow, that's amazing. So, and
Yeah.
it used to be, I think, at least as I've seen some of the older pictures, that hair transplants were sometimes fairly obvious that they had been, that they'd had a graft or something. But it sounds
Oh,
like with
yeah.
that's a whole lot more natural looking, I would assume, right?
So back in the 80s and 90s, when the grafts were much larger, either they were taken out using a big, larger punch, like the size of a pencil eraser. You had these pluggy looking, now Barbie doll hairs, and it's a Barbie summer. So we got to talk about Barbie, right? So no longer are you going to have that Barbie doll look.
Right.
We're using as little as a single hair follicle. But more importantly than that is the artistry involved with the transplant.
Uh-huh.
And that's the key to the whole thing. The design, the shape of the hairline. For women, it's not just this like semicircle around the face. It's a curve, and it recedes, and then it bulges, and it recedes back, and there's changes in hair direction that are nuanced
Mhm,
and difficult to appreciate unless you've studied it.
mhm,
And so female hairlines are very intricate, and I take a lot of pride in creating female hairlines that look beautiful
mhm,
and natural and completely undetectable.
mhm. And then post surgery, what you mentioned that people can be right back in the gym or right immediately afterwards. What do they need to do in order to nurture? I mean, when you transplant a plant from one pot to another, you got to kind of be careful for a little while. What's the process look like afterwards?
Yeah, so the grafted area, let's just say the recipient zone, whether it's a hairline or an eyebrow or even eyelashes or some scar that you have, it's fragile. So you have to be careful with that area. No friction or trauma, unless we're doing under direct guidance here in the office. So many patients will come in once a day after their procedure until they're completely healed.
Right.
So that first week, you might be visiting us if you're here in town.
Mhm,
If you're going home, then you're going to use a no friction washing protocol, and you're going to have an entire healing kit that we provide. So these are ointments, sprays, lotions, and so forth, not only just to keep you comfortable, but also to accelerate the healing from the process that we've done.
cool. So, what have I not asked you that you want to make sure you leave with our audience?
Oh my gosh. Well, we did cover a lot. I guess, sometimes when you're struggling with hair loss out there, you tend to look for that magic vitamin or, some super shampoo or something like that. And unfortunately, that can be very distracting because there's literally thousands and thousands of things that are out there on the market that are geared towards people with thinning hair. And I'll be the first to tell you that, look, nutrition and hair care is certainly important for its aesthetic value and to provide enough nutrients and fuel for the hair follicle. But if you're really struggling with hair loss, you might need to look deeper. And so sometimes it's not so easy to find a board certified hair restoration physician. And that's why, I often get invited on interviews and podcasts to be able to spread the word, because there usually isn't a local hair transplant surgeon or board certified hair restoration physician with a holistic and well rounded approach, or even one that treats men and women in your local neighborhood.
Right.
And so that's why 50% of our patients do connect with us first virtually,
Oh, interesting.
online.
Yeah.
And so I guess I would just encourage any listener, anybody in the sound of my voice, if you're struggling with hair loss or you know somebody who is, pass the information along
Mhm.
that there is hope and help, and that we're well beyond the snake oil age. We're well beyond the hair plug, era of hair restoration and treatments and procedures.
Mhm.
And the only caveat, I guess, would say, just be careful out there in terms of medical tourism. You don't want to be traveling, to distant lands where they don't have regulations and protocols and cleanliness and, things to get you a great result, not and things that could put you in danger in your life. So there is there is some nuance to finding physicians out there, but being board certified and having experience and expertise and focusing exclusively on hair restoration, to me, is the way to go. And
Absolutely.
that's what's built my practice over time.
Sounds awesome. Well, thank you so much. And where can people go to learn more about you?
Yeah. So if you're out there and you're struggling with hair loss, certainly baumanmedical.com, BAUMAN medical.com. I've written over literally thousands of pages of information over the past 25 years in my practice and applied it there. You'll see videos and frequently asked questions about hair loss in men and women, children even, and all the other things that we do to help improve people's lives through maintaining, enhancing, and restoring, their own living and growing hair. And so that's the place to go. You can request a consultation if you're done watching the videos and seeing what we do, or follow me on social media and slide into the DMs there if you've got a question. I do answer all of my own direct messages and private messages on all the social media channels that you can imagine.
Awesome. Well, thank you so much, Dr. Bauman. This has been very informative. Really appreciate your time.
All right, Lauren. Well, it's been great to be with you. Thank you for.
Are you looking for a holistically minded healthcare practitioner who truly treats root cause rather than symptom suppression? Unfortunately, even in the alternative healing professions, this isn't a given. That's why I've created wholehealthdoctor.com, a resource to help connect patients to healthcare practitioners in their area who share a root cause philosophy. Alternatively, most of the practitioners listed also practice telehealth. So if there isn't anyone local to you, you can still find a great practitioner to help you regain optimal health. Go to wholehealthdoctor.com. That's wholehealthdr.com. Type in your location or just the specialty that you're looking for and find the practitioner who's right for you.